I'm Dr. Richard Cardosi, a gynecologic oncologist in the Watson Clinic Department of OB-GYN. I'd like to talk to you today about laser vaginal resurfacing, or diVa. There's a lot of buzz on the internet about this topic. You hear it on daytime and even primetime television. I would like to clear up some of the myths about laser resurfacing and explain to you why we offer it, who it may benefit, and most importantly, why we chose the diVa platform. Events in a woman's life such as childbirth and menopause, whether it's due to aging, chemotherapy, or surgery, can lead to declines in vaginal health and problems such as painful intercourse and urinary incontinence. Historically, we've had little effective therapy to offer patients to address these concerns. Atrophy is the result of a lack of estrogen. This leads to decreased lubrication, vaginal burning, dryness, and a lack of elasticity. Hormonal therapy is actually a very good treatment, but is certainly not for everyone. It is often avoided by cancer patients, especially those with breast or gynecologic cancers, and it carries a small risk of blood clot formation and stroke. Vaginal moisturizers are available over the counter, but can be costly over time, and many women find them messy and undesirable. Lubricants during intercourse are an option, but these interrupt the spontaneity of intimacy. None of these options that I've discussed have any meaningful impact on urinary incontinence. Urinary incontinence is typically a result of trauma or stretching of the pelvic tissues from childbirth or due to chronic coughing, straining with constipation, or heavy lifting over one's lifetime. Treatment options have included pelvic floor exercises such as Kegels, with or without biofeedback, use of a pessary or support device, and surgical correction. Surgery carries risks of anesthesia, costs, postoperative downtime and recovery, as well as scarring, and none of these treatments address the problems associated with vaginal atrophy. Laser vaginal therapy has been around for quite some time, but technological improvements have really occurred over the last several years. It's important for us here at Watson Clinic to offer the latest technological advances to our patients. We therefore chose not only a platform to offer vaginal health benefits, but one that allows us to offer hair reduction and skin tightening as well. We looked into radiofrequency devices and other laser platforms. We chose the Jewel, manufactured by Cyton, for several reasons. The Jewel utilizes hybrid fractional laser technology, which incorporates two separate wavelengths simultaneously to address tissue changes that lead to poor lubrication, laxity, and leakage. This is the sterile quartz dilator that slides into the vagina, stretches the folds of the skin. The laser then slides inside the dilator, and the lasers turn inside this window as it backs out of the vagina. Each patient's specific needs are addressed by customizing our settings on this control panel. The dilator is disposable and leads to a more sanitary procedure since the laser never touches the patient and instead rotates inside the dilator. A new dilator is provided at each treatment session. As shown in this video animation, small holes or channels are created in the vaginal skin, and heat is provided to the skin and supporting structures as the laser rotates and backs out of the vagina. The body's own repair mechanisms then work to fill in these holes, leading to new vaginal skin and supporting tissue with new collagen, elastin, nerves, and blood vessels, which leads to the desired effects of improved vaginal laxity and tone, as well as lubrication. So, what does treatment involve? Treatments typically last about 5 to 7 minutes each. We recommend 3 treatment sessions, each spaced about 4 to 6 weeks apart, and these are performed in a convenient and comfortable office setting. Typically, we recommend a touch-up treatment on an annual basis to maintain healthy tissue and prevent similar problems from recurring in the future. A local anesthetic is used to minimize discomfort, but you may have a pressure sensation and occasionally some increased sensitivity near the vaginal opening along the base of the bladder. Women do have a bloody discharge for a few days following the procedure, but are allowed to return to work and normal activity the same day immediately following treatment, and can even return to intimacy within a few days as well. Candidates for this procedure are any women who would like to reverse the effects of feminine aging and feel more like her younger and sensual self. The procedure is aimed to enhance vaginal lubrication, improve vaginal tone, and decrease laxity, as well as decrease urinary incontinence. We recognize women are often uncomfortable having these discussions, but we encourage you to start the conversation with your provider and see what may be available to improve your vaginal health.
I didn't have any concerns with the diVa. The procedure was very easy to go through. The process was easy. I do recommend the diVa to anybody just because it helps with intimacy, it helps with bladder control, it helps with just the overall moisture of the vagina.
If you are having issues with leakage, laxity, or lubrication, I am confident the Watson Clinic OB-GYN department can assist you, and we would be honored to see you in consultation to discuss your options and help you determine if diVa is appropriate for you. We are only one of 2 OB-GYN groups in the entire state of Florida to offer this advanced technology with the diVa platform. diVa is also a most recommended procedure on realself.com, and we have been recognized as a Diamond Level Center of Excellence due to our experience with this procedure. Call now to schedule your consultation, and immediate appointments are always available.